This hospital has been in this community since 1923. It's a large hospital, over 500 beds. This is a really dedicated, passionate group of employees that want to do the right thing for the right reason. It's all about patient care here. So we really encourage in our culture to be innovative, come up with the best way. They have the answers. It's like having over 4,000 consultants working for you.
This project, which we fondly call HAPPY, which stands for Hospital Acquired Pneumonia Prevention Initiative, a very astute ICU nurse asked me a question. She said, "Barbara, do we have a problem with patients in our hospital getting pneumonia?" I assumed she was talking about ventilator-associated pneumonia, but she said, no, it's not our ventilator patients. It's the patients who come in for one thing, get pneumonia. Sometimes they're ventilated and sometimes they die. She said, "Barbara, is that a problem?" And I had to tell her, I don't know, because we're not measuring that. That led me on this journey to answer that question.
And when she couldn't answer the question, it really bothered her. So she did the literature search, and the literature search wasn't there. So she partnered with a local vendor, and she said, I'm going to figure out how we can make patients safer by something as simple as possibly teeth brushing.
When we were first starting and people weren't quite understanding what the return on investment might be. So we brought in the toothbrush, the toothpaste, and we let them brush their teeth. And by the end of that little session, they were spitting bristles out of their mouths and said, okay, this is not going to work. We immediately got funding.
We had to figure out the science, we had to figure out what the right thing to do was, and then we had to make the right thing easy for our staff. And then we really had to look at processes and gauge our staff in those processes because they know the right thing to do.
Set up their toothbrush, toothpaste, and mouthwash and everything, and I said, have you heard about our oral care program? We want you to brush your teeth and rinse with mouthwash 4 times a day. And they go, 4 times a day? And they get kind of, well, I don't even do that at home. I said, well, maybe it's not necessary at home, but at home you're moving around, but here you're just laying in the bed, you've got bacteria being aspirated right into your lungs. And so they go, oh, really? Okay. Well, here, give me my toothbrush.
For years, we've always just designed education that we thought was good, and without asking the patients or families if that was really meaningful to them. So we came up with our own draft, but we took it to our patient family advisory group, and they were so engaged, they were inspired by the project.
We made them accessible, and then in the ICUs, we put them together in these packs. You just got a pack for the patient, and then they knew exactly what to do. We trained the nurses on how to use these packs. We trained our patient care techs, our nurses' aides.
You know, if this is a problem at Sutter, which is a top 100 hospital, this must be a problem elsewhere. That eventually led us to launch a national study looking at over 21 hospitals of all sorts. We found the same thing. Not only was MV-HAP a serious problem, had a very high associated mortality and millions of dollars in cost.
We saved over 30 lives, $6 million. We've already seen a significant reduction in hospital-acquired pneumonia as oral care frequency has increased.
The data was pretty clear. If you do these things, you will see these kind of outcomes. It's basic care, it's brushing your teeth. We didn't need a machine, we didn't need anything. It was literally use these better products, do it this many times a day to get these outcomes.
Anybody, once they see the data and they hear the stories of the patients, it's so compelling that everybody gets on board.
One of our goals was to provide enough motivation to take oral care from being a nice thing to do, like it's comfortable and it's nice, to necessary and life-saving.
In the first 30 months, we calculate that we have avoided over 160 cases of MV-HAP.
As one of the flagship hospitals within Sutter Health, we take these great innovations and we figure out how to rapidly spread them through the rest of the Sutter system so that we can take these ideas to patients throughout all of Northern California.
80% of all patients in the hospital can brush their own teeth. They just need the information to understand why it's important.
Take the little ideas, fan the flame, promote nurse research. All of this together makes for better patient care. And that simple question, gee, it seems like a lot of people are getting into respiratory trouble. Do we have a problem with that? Started this whole adventure for us, and it's been a great journey.